This medicine is a combination of vitamins and iron and is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body and help to maintain good health. It provides benefits such as improving overall health and preventing vitamin deficiencies. The daily dosage for children is determined by their age and specific nutritional needs. It is recommended to take this medication with food to help with absorption. Make sure to chew the children's chewable thoroughly and swallow it, usually once daily or as directed by your doctor. It's best to take this medication on an empty stomach, about 1 hour before or 2 hours after meals. If your child experiences any stomach upset, they can take this medication with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication, as it can decrease its effectiveness. Taking this medication regularly at the same time each day will help your child get the most benefit from it. If your child experiences constipation, diarrhea, or an upset stomach while taking children's chewable, these effects are usually temporary and may go away as their body gets used to the medication. If these effects persist or worsen, it's important to contact your doctor or pharmacist. Iron in this medication may cause your child's stools to turn black, but this is not harmful. Your child's doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this medication can occur. Seek medical help immediately if your child shows any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if your child experiences any other effects, it's important to contact their doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. It is important to follow the recommended dosage for children's chewable vitamins to avoid any potential risks. These chewable vitamins are beneficial for children as they provide essential nutrients for their growth and development. The recommended daily dosage for children's chewable vitamins varies depending on the age and specific needs of the child. It is best to take these vitamins at the same time each day to establish a routine and ensure consistency. Before giving children's chewable to your child, make sure to inform your doctor or pharmacist if your child is allergic to any of its ingredients or if they have any other allergies. It's important to discuss any medical history including iron overload disorder, alcohol use/abuse, liver problems, and stomach/intestinal problems. If the multivitamin contains folic acid, let your doctor know if your child has a vitamin B12 deficiency. This medication may contain aspartame, so consult your doctor if your child has phenylketonuria or any other condition that requires restrictions on aspartame intake. Before any surgery, inform your doctor or dentist about all the products your child is using. If your child is pregnant or breastfeeding, consult with your doctor before using this medication. It's important to be aware of any potential drug interactions that may occur when taking children's chewable. This product has the potential to interact with medications such as chloramphenicol and methyldopa. Additionally, it can also decrease the absorption of other drugs like bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to ensure the safe and effective use of this medication. Be sure to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your brand of multivitamin contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. If a person takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911. Otherwise, contacting a poison control center is necessary. In the U.S., Individuals can reach out to their local poison control center at 1-800-222-1222. Canadian residents are advised to contact a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Remember to keep all your medical and lab appointments. Children's Chewable is not a replacement for a healthy diet. It's important to get vitamins and minerals from nutritious foods. Make sure your child maintains a well-balanced diet and follows any dietary guidelines recommended by their doctor. And remember, always consult with a healthcare professional before giving any medication to your child. If your child is taking this product on a prescribed schedule and misses a dose, give it to them as soon as you remember. If it is near the time of the next dose, skip the missed dose. Give the next dose at the regular time. Do not give them double the dose to make up for the missed one. When it comes to children's chewable, it's important to store them at room temperature and away from light and moisture. Avoid storing them in the bathroom and make sure to keep them out of reach of children and pets. And when it comes to getting rid of them, don't flush them down the toilet or pour them into a drain unless specifically told to do so. Instead, properly discard this product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.